Hey guys. So I'm pregnant with my fourth baby, as you know. I'm 34 weeks pregnant today, actually, quite pregnant. And I've had bladder issues. I've had tenderness in my pubic bone. I've just had like stuff in the pelvic floor area this pregnancy that was new to me. I'm 33. This is my fourth baby. So it makes sense. But also, what I learned from Christina from Tighten Your Tinkler, a pelvic floor specialist who I'm going to talk with on this interview today, is that we don't have to suffer with these things. So we're going to go over the basics. This is not super technical. It's mom to mom, woman to woman. We're going to talk about hemorrhoids, diastasis recti. We're going to talk about pleasure issues in the vaginal canal and prolapse. We're going to talk about poop getting constipated and stuck, peeing too often or too much or it doesn't feel good. And Christina and her business partner, Jenn, have an online program you can do from the privacy of your own home. It's holistic. Let's go.
Welcome to the Postpartum Coach podcast, where we embrace our needs as moms, we learn to lead ourselves first, then our families, and where we create our own healing from the inside out to find our way to the work we were meant to do in this world. I'm your host, a fellow mom of 3 and a certified life coach, Lizzie Langston.
Hello, everybody. Welcome back to the Postpartum Coach podcast. I am going to be learning with you today. I'm here with Christina. So listen, guys, I'm pregnant with my fourth baby, and pelvic floor health is something that's been on my mind as I sneeze and then pee my pants. For the first time, I'm pregnant. I'm 33, and this is like I said, my fourth pregnancy. All my other pregnancies were in my 20s. So it's about time. It's past time, actually. It's past due to be learning about my freaking pelvic floor health. And don't worry, I'm going to be embarrassingly sharing things, I'm sure, today. I want us all to just understand pelvic floor health. Now, some of you guys out there, some of you girls, I should say, ladies, mamas, probably already know this stuff. Maybe you've had an unfortunate diagnosis or something that went wrong to where you were forced into understanding this stuff. I have not had any issues that I am aware of with my pelvic floor. There is so much down in your pelvic floor. We're going to be talking about all the anatomy that sits on the cradle of the bottom of your, the root of your your upper body. And there's so much there. There's so many things that could go wrong, but we're not here to scare you. We're just going to educate. And by we, I mean Christina. I'm literally going to be learning. I know very little, but just so y'all know, I'll be learning with you. So we are in for a treat. Christina, I am going to let you go ahead and introduce yourself and tell us a little bit of your story. Share with us about your business, how you kind of got into this world. And then we're going to get into some stuff that needs to be talked about and the mamas need to know. So go for it.
Absolutely. Christina Walsh, physical therapist, mama of 2. They're 7 and 5, girl and boy, and living in New Orleans. Been here almost 20 years. And I really want to start, this is a bit of a diversion, but bear with me. I want to thank you first for the work that you do in this world. I have such a heart connection with you and the way that you serve women, the words that you use, the points of connection that you make. And it's so personal to me because the stories that you talk about that women go through in that transition to becoming mom, I was blessed with a happy childhood, and I was always really excited to become a mom, and it was something I'd kind of dreamed about and wanted for. Didn't rush into it. I was 32 for my first, and it happened to coincide with losing my own mother, and it threw me for a loop that I was ill prepared for to make those two transitions at the same time. And the way you speak about women needing other women and connecting with our maternal energy, it was such a difficult transition for me emotionally that everything that you speak about speaks deeply to my heart. And I love the work that you do and the way that you serve women in this vulnerable stage. And it aligns so deeply with the way that I'm able to serve women. And I've always felt so deeply connected to feminine energy and maternal energy. And I think I always abstractly knew, I'm going to work with women in this stage somehow in maternalness or in childbearing years. I didn't know what that was going to look like. And life guides us.
It does.
I
Amen.
Never could have predicted, right, that I would end up where I am. And I ended up in physical therapy because it I was fascinated with anatomy. I'm such a nerd for the body and its miraculous capabilities. And physical therapy somehow just jumped out as like the way to do that for me. And I pursued that and then graduated and didn't feel aligned in the work that I was doing. And I thought, where am I meant to go? And I then had a whiplash injury.
Oh, what, from a car accident or something?
Well, interestingly, I was kind of attacked by a cousin in a pool. It was not intentional, of course.
Just kind of attacked. Just sort of kind of.
Sort of kind of attacked. We could go on and on about the emotional layers I've unraveled about all of that because I had so much fear about like being able to do my job. And I was incapacitated by this for quite some time. And
oh my gosh.
It led me on a journey to finding integrative manual therapy and craniosacral therapy, body work modalities.
Okay. How specific is that experience? Like, to take you into the... Really? I mean, talk about the universe intervening in all of our lives. We're all on the exact journeys we need to be on, even if it's sucking. Yeah. Promise.
I have so much faith in that. And it's hardest to see when you're in pain. It's so hard to see, how is this guided? How is this meant for me? But it always is.
Yeah.
And so I was guided to this bodywork practice that tapped into more of a feminine energy, to the energy of connecting emotion and story and body.
Yes.
And I mean, it was where I felt like I found what I didn't know I was looking for, is how it felt when I found this work. And then life took me in another direction. So then Miss Jennifer Lormand, exercise physiologist extraordinaire, who is now my business partner, ended up on my treatment table in my practice, seeking help for injuries from her births, back pain, pelvic floor problems, and she was already working with women.
Hold on. Sorry, you just said injuries from her births, and I had a moment where I clicked because I was like, how many of us experience pain in our low back, in our hips, in our like vaginal area, vulva, all of that.
Yes.
And we don't call it an injury. We just kind of deal with it because we're like busy chasing babies around the house and running our baby to the pediatrician. It's like, honey, you could be legit injured. Like, you know, if sex isn't feeling good, you could have an injury that you need a physical therapist to help you, just like an athlete goes. I don't know. I'm just having this moment where I'm like, I love calling it an injury just for a minute. Like, let's just go ahead and treat it like that.
It validates how much it impacts your life.
Yeah.
And very much like when I heard trauma redefined, I had always thought of trauma as like I was in a war zone. It doesn't have to be a war zone. I heard it much more compassionately redefined as being pushed past your ability to cope under the circumstances you're in at that time.
Oh, I love that. That's exactly what it is.
Yes. And so it's validating when we redefine trauma more compassionately that way. And when we talk about these things as injuries, it's validating and it justifies your worthiness to receive support to get better.
That's so good.
Yes.
It's so good because I've never sought out support for pelvic floor anything. And then with this pregnancy, I literally just told myself the peeing of my pants. I'm like, well, I am in my 30s. It is my fourth baby. So I never actually considered that there could be solutions to these things. I'm so excited. Keep going. I keep interrupting you.
No, this is perfect because it's so important to come full circle about this. When we talk about this part of our body, which we're going to talk more about, it is the root. It is the center energetically of our being, especially as women. It's our center of gravity from like an anatomy nerd standpoint. It's undeniably important in our well-being as the way we show up in this world. And I can speak from personal experience there. And so, as I said, my future partner, Jennifer Lormand, ended up on my treatment table, and she was looking for support and deeply connected with the work I was doing immediately. And we just had an energetic bond right away. And she said, I need you to come work out of my personal training gym because every woman that I train needs this work to heal.
Yeah.
And so we worked as separate businesses under one roof, taking care of women together, learning from each other, benefiting from the different ways we were able to touch and support each individual. It was an incredibly uplifting experience. And then I had my first child. And Jenn and I's stories complement each other and come full circle from a what have you been through standpoint. Her births were very traumatic, and both physically and mentally and emotionally. my birth, because I had the benefit of knowing what happens to women when they aren't intentional about their birth, I had the benefit of knowing what I wanted going into it. I planned a midwife. I planned a doula. I read, Ida May, and I felt very prepared and aligned going into my birth.
Ida May. Shout out to Ida May, one of the midwife of all midwives. No. Mwah. Love you, Ida. Keep going.
So I had the benefit of others' experience to go into, and I had a trauma-free midwife, doula-assisted, no tearing, no doctors present birth. But there are so much we don't get to control this experience, right? So I still ended up
Not
pushing
completely.
for several hours and ended up needing help for some issues I had, injuries you could call them, despite my smooth, like textbook, beautiful birth experience. And so between Jenn and I, we both understand either end of that spectrum, and you are worthy of healing no matter where you fall on that when it comes to your center. So that's one gift that we can bring is those varieties of birth experiences.
Well, I am like getting excited because we've talked a bit before this interview, and we've talked about, you said your center. That's what sparked something in me, injuries around your center, because y'all, like the pelvic floor is also energetically your root. If you look at the chakras or chakras, whatever, I know people say, I like chakra better, but I say chakra because I think it's more right, but I like chakra better. Okay. Anyway.
I say chakra too.
Okay. It just sounds so French. It sounds French or something. Okay. So, but like your root and your sacral are your first two chakras. Am I right? Is that right?
Yep.
Okay.
Yep.
The red and then the orange. And that, think about that. If you have injuries around the energetic, your root chakra is all about safety. And your sacral is all about sexual expression and freedom, but also creative expression and freedom.
Yes.
And so think about the impact of physical abnormalities or injuries or things that aren't working optimally in those areas of your energetic centers and how that could be impacting your overall energetic, like creativity in your life, stagnation in creativity, or feeling broken in your ability to get creative and know what you want to do. And also your sexual expression and just how important it is to feel good in intimacy. And then also just your general sense of being provided for by the universe, by your partner, by just life in general, and safety in your body. Like the pelvic floor really is centering around our most primal foundational pieces. So shall we go into the anatomy now, Christina? Do you think that would be a good idea?
Yes, absolutely. Okay. And, so it is personal for Jenn and I. We are also nerds for anatomy. So I will not get too clinical here with you. That's not the point.
Yeah.
The point, I think, is more, I'll give you a little framework here. The pelvic floor is, I don't want it to be a scary word. It's just a sling of muscle that holds your guts in.
Ooh, there y'all have it. End of the episode. That's a wrap. It's a sling of muscle that holds your guts in.
Yes. So like a really important job. Hello.
And not just your guts, but like, doesn't it kind of tone your vaginal canal, which is where baby comes out? It's where in penetration, poop. And then there's pooping, peeing, and penetration.
Yes. And birth all happen there. Yeah. It's a very busy area. So we need it to work well for us. And you deserve for it to work well. And it's possible for it to work well again, even if it is not right now, or you experience something like that in the future. The biggest message I want you to hear is a message of hope. Yeah. Because I know, Jenn and I know how broken you can feel. And like Lizzie, the way you just said it all and connected all those dots is exactly how it feels. Mm-hmm. When you feel broken there, you cannot feel well, and you cannot show up with the energy that you want for your family and for yourself.
It's your root. It is,
It is deep.
Yeah. Now, those of you guys who don't have any issues, because that was me for most of my pregnancies, we're also going to be talking to you. We're going to be educating you about what could go wrong and things to look out for. Again, we're not trying to scare you. We just want to empower you so that you can act quickly. Yes. Instead of for months just dealing with it like I've been, right? With my urinary incontinence. Now I feel like 50 years old. It's fine. Not that there's anything wrong with being 50, by the way, everyone. But here I am 33. It's anyway. So yeah, we want you to be able to act quickly. And also one more thing I want to say before we get going here is that Christina and Jenn, they have an online offering. So guys, like even though she lives in New Orleans, that doesn't matter because they have something for you and I'm going to get you a code. The reason I chose them is because I didn't want to interview somebody who you got attached to. You guys were like, oh, I trust her. She could help me. She knows a lot. You know, she knows what she's doing. And then she lives, 5 states away from you or in a different country than you. Whereas their program, they actually ship you a product and like a ball of sorts that we'll talk more about it.
That does not go inside your body at all.
Yeah, non-invasive. That was the other thing is, can you imagine? There are so many wands and things that people have to get all freaky deaky with their PT and their pelvic floor health. And like, they don't have that. They literally, it's on the outside of your body and it kind of just looks like you're exercising. I've watched videos of how it works. And so I specifically chose these women because not only of their stories, their energy, their holistic approach, their very Eastern integrated approach, but also they have something that you can purchase online and be private about these issues, right? If you don't want to have to walk into somebody's office and have them stick a wand or whatever, tell you to go home and do this and that. It's like, don't worry. They've got a course, a community, and a product that you can do from home and educate yourself, and that can be really empowering. So without further ado, let's go ahead and tell us the actual pieces of anatomy that are in this fleshy bowl of the pelvic floor, and then the most common issues you see. Go ahead. Yeah.
Yes. So I think you hit the nail on the head. It's pee, it's poo, it's penetration, all the things that are involved there. So it's your bladder and then the tube that the pee comes out of called the urethra, your uterus, your vaginal canal. It's your rectum and the anus. It's all of that is a part of this.
That's a lot though.
It connects to the bony pieces right here too for support. So it connects to that pubic joint, which is where your pelvis comes together in the front, that hard spot just above your labia.
Yeah.
It connects to the same muscle that your hips do. So this is all very intertwined with women who have chronically tight hip flexors. It connects to your deep abdominals and your low back, your sacrum, your tailbone. So all of this is integrated and it is one unit and it needs to be able to work that way, which is why, I could go on a tangent all day of why Kegels don't work. People were teaching that.
Did we hear that? Guys, that's something I learned in our pre-interview. Kegels don't work. Did you know that? Can we just tell us why? Just real quick. Because I was preached Kegels and I always felt guilty because I hated doing them.
And I think that they were taught, I don't ever want to throw anyone under a bus. Like anyone who gets into a caring profession, I trust that they got into it with the best intentions of taking care of other people. I believe that Kegels were taught and sometimes still are. And when I say Kegels, I mean any kind of bracing either. Like if you're told to insert a wand and squeeze or any kind of just sort of thing, that is not going to make strength that translates into daily life. Like think about it. So do you exercise any other muscle without movement? Like no. Would you ever go to a yoga class or a gym and not move your body to try to exercise?
It's like the equivalent of saying, okay, lay on your yoga mat, and instead of doing yoga, I just want you to squeeze your buns. Just squeeze them. Squeeze your butt together, and that'll just get your butt so strong.
And I think it was taught because nobody had figured out another way.
Yeah.
But there is a better way now. And the other reason it doesn't make sense is because we don't... Now, has that muscle ever been something prior to having issues with it that you had to think about consciously?
No.
Absolutely not. It just knows what its job is and it's happy to do it.
Right.
And our bodies are always trying to work for us. That is a message I've heard you say and that aligns so much with what we teach and the way we teach it. Your body wants to heal. And sometimes all it needs is a little nudge in the right direction to go the place it was trying to go anyway. So there is a better way to access bringing that muscle back to life in a way that doesn't have to be something you think about. It shouldn't be something you have to think about. That's not helpful.
Yeah. Okay.
So that's why Kegels are not effective and they can actually cause over tightening.
Yeah.
Which is also not helpful and ends up causing a lot of the same symptoms or issues that a tight muscle is still a weak muscle. A tight muscle is not a strong muscle. An over tight muscle is a weak muscle. So if you're concerned or been told you have a tight pelvic floor or a hypertonic pelvic floor, it is still weak. The step that we need to put in that I'll give you a little hack for and that we address in our program is connecting it to the nervous system and learning how to rest and relax.
Wait. Everything comes back to the nervous system.
Yes.
If my listeners haven't kind of picked up on that by now, y'all, I just want you to know, I truly believe the longer I've been coaching,
you see why I'm like, you're like fangirl, because everything you talk about, I'm like, yes, exactly.
Yeah, we're getting it. We're collectively all getting it. It's not just your thoughts. It's not just your whatever, anything. It's not just this. I mean, it's just the nervous system.
And I will like anatomy geek out with you without too many terms right now, because the fight or flight nerve, the nerve that is activated when you're feeling spun up and stressed, that nerve connects to your bladder also.
Ooh.
So, I mean, it is a very direct line what we're talking about here. This is not abstract, that we've got to bring the nervous system in to heal these pieces.
Ooh, that's so cool. I'm like, we're basically tag teaming this. I'm helping their nervous systems. You're helping their nervous systems. You're helping all their anatomy down there. It's great. So
Exactly.
let's start with the basics of what can go wrong. And maybe you guys will hear one of your own diagnoses in this list, or maybe you'll be like, I've never heard of any of these. I want you to say the clinical name so that they can recognize that if they have had a diagnosis or if they hear one in the future, but then also just be like basically what that is.
Okay, so how does this feel when things are like not right down there?
Mm-hmm.
It can be such a wide array of things, and certainly we all think of bladder issues. So that includes leaks with laughing, coughing, sneezing, or jumping. That includes peeing more than 10 times a day. That is not normal. I don't care how much water you drink. Yes, I'm talking to you.
Mm-hmm.
Getting up at night to pee. That is not normal and does not have to be something you accept for the rest of your life.
I mean, pregnancy, there's an exception, yeah?
Yeah. Yes. Okay. Pregnancy. Yeah. We can make positive change during pregnancy, but I cannot guarantee the same degree of relief when your 8-pound baby is sitting directly on your bladder.
Yeah. So this is something real quick to just address this. This is something I asked Christina is, okay, so could I start your program now while I'm pregnant? She's like, absolutely. It's just that you're probably going to see the most healing be able to occur after you have that baby and a little while after. Like, what's the most ideal time postpartum to start? Like if you've identified an issue at all, to start your program and start working on it?
Yes, certainly we always say check with your provider. So it's usually don't start until you get that clearance to return to movement, which is usually at that 6-week visit or maybe later, depending on your birth and healing.
Mm-hmm, depending on your birth trauma. Yeah.
And so while we want to encourage everybody to seek help when they feel this stuff going wrong, there's also not an it's too late date.
Okay.
Like, so that is a liberating thing to imagine that, like, okay, if I can't attend to this now, but it doesn't get better in a couple of months, or a couple of years, is it too late for me? Absolutely not.
Right. And watch out for that discouragement, ladies, right? Because sometimes the discouragement with something that's been going on for so long leads you to get to the place where you're hopeless and you're like, I just don't think it's ever going to go away. And it's like, but what if you just haven't found the right person and program to help you?
Totally.
Yeah.
One of our favorite testimonials came from a lady who was 28 years past the birth of her last child.
And had lived with something, I'm assuming, a symptom of.
Yes. And you can imagine her joy in reaching out to us as she felt her body change and these things that she had lived with start to disappear. I mean, it is, I know.
Guys, don't be that lady though. Love her, but don't be her.
You don't have to be that story. You don't have to be that story at all. So it can be the bladder stuff. It can be getting back and hip stuff. Like, okay, so the women tell us all the time, like, we're moms, so we're used to like powering through stuff. So if you ask a mama, is your back hurting? If you use the word hurt and pain, most women say, no, I'm fine. And then we'll ask, well, how do you sleep? And like, well, I feel like I constantly have to change positions because like my back will wake me up or my hip will wake me up. Or I feel like I constantly have to stretch. My back throughout the day. We're talking to you where your hip flexors are chronically over tight because they're trying to do a job that's not theirs. Your body is trying to help you. But if it doesn't have the nudge it needs for the right things to do the job, another thing will do the job.
Okay, so you're saying, okay, so listen, I was thinking pelvic floor health is down if we have things happening in the pelvic floor. But you're saying actually one of the signs of pelvic floor health or tone being weak, because it's all muscles, I guess, and tissues being weak is if you have hip issues and low back issues.
Absolutely, because all those muscles connect in the same places.
And they're going to be overcompensating for the weaknesses in your pelvic floor.
Or your deep abdominals, your core, right? It's all one. It should be one function, one unit of like, I know what to do and I've got you, girl. But if one piece is broken down, the other ones will be doing too much, and you could experience any of these like quote unquote symptoms that were going on are all related and can all be fixed with the same
Got it.
thing, which is the hopeful piece. So the other thing that women report is pressure or heaviness. It can be in your lower abdomen or down there. It can feel like a bulge. This is bumping into the realm of prolapse. And not to scare you with terms, all that means is, your organs in the pelvic bowl are held up by soft tissue. There's no bone keeping your bladder in the right place, your vagina in the right place, and your rectum in the right place. It's all soft tissue.
And it's squishy.
And so if that is, squishy. So if that has been stretched beyond its ability to find its happy place again through pregnancy or birth, things start to kind of fall into each other and then fall down as well. And that's what prolapse means. And it looks different for every woman. You don't need a diagnosis, but if you feel that bulge, that's probably what's happening. Don't be afraid. There is relief available that's not scary. And that can be a bulge, that can be your bladder falling, that can be the uterus falling, that can be the rectum falling.
That can be your vagina walls falling down.
Collapsing.
Like a flower petal that's supposed to be perky and all of a sudden it's wilting. And you start to see it falling. So basically, what are some things that if they or their partner sees any of these things, it would be like, for sure, go get your program or talk to somebody? Like, what would be?
So anything, it really comes down to what you're okay with and what you're not okay with living with. So when any of the things, the other piece we didn't talk about is the sexual issues. And that can look very different for every woman. That's not just pain with penetration. That can be soreness and swelling in the vaginal region after sex, puffiness, heaviness. That can be a sore achiness up higher in the abdomen because the tone is gone and you're basically being like, your organs are kind of being punched from the inside during sex. So sexual dysfunction or just diminished orgasms because the tone isn't there. Most women don't join the program for that, but we've had a lot of very excited messages come through when that gets better.
That's so cute. I love that. I'm cheering for the pleasure.
Like how do you know when to seek help is really your baseline of anything that I've talked about as quote unquote a symptom of this. If you're not okay with living with it and you'd like to fix it, then you're appropriate to join and receive help.
Is diastasis recti or diastasis recti, however you say it? How do you say it?
Yes. This is always a hot topic for debate, and I say diastasis, but diastasis, it's like chakra. We know what we're talking about.
Diastasis
That's just that separation of the abs, the six-pack muscles.
Is that something you guys help with, or is that not pelvic floor?
Absolutely, yeah. Okay. That was the part I didn't get to in our story is that Jenn and I are such nerds that we did a 3-year university research study on our protocol prior to being guided to put it online. So that is all stuff that we can speak to. I have the specific data. I can tell you what percentage of all these improved symptoms will improve in what amount of time. And that gives Jenn and I a lot of confidence to be able to say, I can promise you, if you follow this will get better. This will get better. And we did measure diastasis recti in that research as well. And that now everything has a point. If you have a 4 or 5 finger width diastasis recti, that's past the point of conservative help. If you might need surgical help, usually to close it. But sometimes you can still get your deep abdominals. So the layer that supports your back is not that 6-pack layer. It's a deeper layer of your abs that kind of wraps around you more like a corset. So if you can get that layer activated, who cares about the closure? I mean, it's an aesthetic concern at that point. But if you can get that deep layer supporting you again, which is what happens when you get the right movement back in, like through our signature program, then you don't have to worry about, is it closed all the way, except for the aesthetic component, which I respect is a concern for many women. For sure. And same with prolapse. There's a point, if your organ is exiting your body all the way, that's beyond the point of what we can help with. So I don't want to overpromise, but stage 0 to 2, you don't have to be graded or staged. That's why we have our quiz on our website. It tells you, it compares how you are in all these areas to the women in our research study. And we can tell you with confidence, you're a great fit or you're not. So if you're like, gosh, could this be for me? I have like a couple of those things and I really like not to live with them forever. Then take our 5-minute quiz on the website or on our Instagram.
You guys, her website will be in the show notes. What is it, just so they know?
Oh, tightenyourtinkler.com.
Tighten your Tinkler. It's so cute. I feel like I brought you guys the best team that I possibly could, because I've been approached by pelvic floor people, but they're local, and a lot of them, so that's number one problem is you guys, I can't really give you a promo code for somebody who doesn't live where you live. So, Sarah and Christina are online.
Oh, Jenn. Oh
my gosh. I'm so sorry. You guys, to be honest, I haven't met Jenn. Okay. I've only talked with Christina. Okay. So I'm going to give myself an out with the names, and I'm pregnant. Okay. I'm 33 weeks.
Other children.
It's not Sarah. It's Jenn. It's fine. Okay. And I have 3 other children. Thank you. Yeah. So, I just feel really excited about the fact that, they are available to all of you right now. And also, I'm very private. I'm a private person. My astrologist even told me that. I already knew that, but then she was like, "Oh yeah, you're really private." I'm like, "Oh, thank you." It works great because I coach people on a very private matter, their mental health postpartum. So it's fascinatingly perfect for me. But I wouldn't want to be walking into some probably male-oriented, I don't know, PT office with people in sports jackets, and there's also athletes there, and I'm like, "Hi, my vagina is not working and sex doesn't feel good." So I just love that this is by women for women. It's online. You can do it in the privacy of your home.
But with your clothes still on.
And with your clothes, or not. I mean, hey.
Or not. You do you, girl. But women send us pictures of, your kids want to move along with you. And so they're doing the routine right alongside you. And it can be something you can do together. So and even just in that, there's so much shame around all this stuff because of the culture that we live in. And that can start peeling back those layers as you begin to heal. And it doesn't have to be this behind closed doors thing. Yeah. It's like, I talk to my kids. I'm doing my exercises to help me feel good as a mom. Yeah. And I want them to see that.
Yeah. So question, are hemorrhoids, because hemorrhoids is a big topic. I feel like so many of my clients or myself or all the people, like all the moms, they're either terrified of them happening during pregnancy, or they're already struggling with them, or they start happening postpartum. So is that a pelvic floor issue? Is that something that can be solved through your program, through the movements you teach?
That is a very tricky, nuanced question. Hemorrhoids generally do reflect some kind of pressure imbalance, which, the pelvic floor around the rectum has been pressed down and out to a point that's caused that.
Okay.
So certainly beginning to work on breath work. And we're going to go over a whole list of things you can start doing at home right away to move things in the right direction. And one of those things, bridging perfectly, is breath work, because hemorrhoids relate to pressure balance. So you've got to start rebalancing the pressure in that whole pelvis and abdomen. Make sure you're expanding your ribs in all 3 planes and bringing yourself out of that fight or flight place. So hemorrhoids are tricky because they can be also confused with what's called a rectocele or rectal prolapse. Which, is it the vessel that's bulging? Is it the rectum itself that's bulging?
The rectum would be like the tunnel, the tube where your poop comes out, and it's inside your body, right? And then there's the opening, which is where you poop. And you're saying sometimes people think hemorrhoids are, what they think is hemorrhoids is actually the rectum prolapsing out of their body.
Yes. So it's a tricky one to talk about without kind of visuals and more individual information on anyone's case, because it can be quite nuanced.
Okay.
Jenn's favorite hemorrhoid hack is taking the Preparation H capsules and putting them in the fridge. So you get like a little cold therapy. If you're at that point where you've got hemorrhoids and you're using that sort of thing, that's her favorite hemorrhoid hack.
Oh, I didn't even know. I've heard of Preparation H, but I don't know what it is.
But I think when we're thinking about, we want to try not to be afraid of any of this, right? So when you've set yourself up with a birth plan that you are confident in, you're surrounded by people who are there to uplift you and support you, and you know that to your core. We want to try to get past that fear of birth, and that alone will set you up for most success and less injury.
Yeah.
So when you're choosing a birth plan that feels aligned in your heart and you feel supported, you're going to be so much less likely to have any of this happen.
Yeah, true. I think there might be a lot of women like me who their body has been there for them for multiple pregnancies, or at least 1 or 2. And I want to know about this stuff as a preventative and as an educational piece, because I'm in my 30s now, because I'm having my fourth baby, and it's been like 5 years since my last baby. And so, I'm coming at it from sort of a proactive approach.
Yes.
And then,
and I know you're like totally owning your birth plan this time around. I've heard you reflect on that. Right. So you are so setting yourself up for success, choosing a path of less intervention.
Yeah.
With understanding that we can only control so much in the very visceral, primal process of birth. But when we make choices to receive less intervention, I believe that sets us up for less injury. Likely.
Well, and let's talk real quick about the nervous system too, because the tone of how activated or how basically how unsafe you feel. It's so fascinating. We can go to the hospital, go through an entire birth and not realize that the whole time there was a part of us that didn't feel safe. And that is exactly what happens. And that is exactly what causes a lot of birth issues, trauma. Babies get stuck. Or they have to be forced out because mama is not actually relaxed. She thinks she's relaxed. She's not relaxed. She thinks she's safe in the hospital. She actually doesn't feel safe in the hospital. And so we have to get really honest with ourselves, and do that introspective work. But sometimes we're just so disconnected from ourselves, and we're in a functional freeze going into pregnancy, going into birth, that was me, by the way. I know this because this was me. I was so busy trying to make the nurses feel good in my room. Yes. I was nurturing other people because I was in a state of hypervigilance and self-abandonment. I didn't know any of this shiz. I didn't know any of it.
And birth can be very triggering if you've had any history of sexual trauma or other birth trauma in the past, or just any sort of physical trauma. And I know I've heard you speak about this. You are at a greater risk to feel in that place of unsafety and have all of those feelings. If you haven't taken a moment to process them and feel them, they are likely to rise up.
It's true. That's why I have a job. It's why I have a job. It's why my job is so interesting and can get so, well, first of all, it can hit women so unexpectedly. There's even a philosophy that my yoga instructor, she's been in the healing world and yoga world for many, many years. Very wise. Her name is Sil Carson with Bodhi Yoga. Anyway, and she does talk about how, because the baby, assuming that the baby's coming through the vaginal canal and there's a vaginal birth, but even if not, it's blowing right through your root chakra. Yep. And so any lack of safety happening in your life is now blown open. And also if you have toxic or really not good feeling relationship with your parents, either one or both of them, or an absent relationship or neglectful relationship, that does impact how you birth, which is just why it's so important to get in, whether you're with a therapist or a coach or somebody in between like me that does a little bit of all of it. But to have these explorations with yourself to try to avoid birth trauma. Anyway, I just had to put that out there.
I completely agree. And I've loved the way you've spoken about that because it does connect so deeply to the way that we're able to serve women in that healing journey. Yeah. When we start to heal on one plane, we enable more healing on the other. Yeah. And it can become an upward spiral when we start to pour into ourselves. So maybe you start with therapy and then you realize, okay, actually I need to do some physical healing too. Or maybe you start with the physical healing and it opens you up to receive the emotional healing.
Right.
Because it starts to spiral upward, not downward. Mm-hmm. So start pouring into that cup of you, no matter which place you feel comfortable beginning that journey, and it will all come upward together.
Question, Christina.
Yeah.
Do your people ever experience emotional releases while they're healing their pelvic floor? Can you tell me about that? Speaking of this connection between the physical and the emotional, I want to hear.
Yes, absolutely. Because you start to feel the feeling that many women come to us with at a very deep level is a sense of brokenness. My body has betrayed me. I thought I was built for this. I thought my body was designed to do this. Why do I feel this way? Why do I feel broken? Why am I having all this dysfunction? So when you start to feel that sense of brokenness lift and you realize you don't have to be afraid for your safety at your center anymore, it is incredibly cathartic. And it opens you up to receive love and support in the emotional realm as well.
Yeah.
So absolutely, it's an emotional experience. And we talk about that within our signature program because you cannot separate the two journeys.
Yeah. Yeah. Also, just again, this energetic spiritual component. I don't know. I just tend to think that there are the physical, emotional, and energetic and spiritual are all one. And so when your rectum is falling out of your anus, okay, like we naturally, obviously it's alarming and we want to treat it like a physical problem, but it's possible that there could be more to it than that for you. There could be emotional stuff with it as well. And as you go about healing it, you're emotionally healing as well and energetically.
And sometimes you need to rope in support on both planes to really get the most out of that healing journey. I know Jenn talks about the way she explains her story with prolapse. She says it's no coincidence that for my whole life, I was basically, my survival mode was have a feeling, stuff it down, stuff it down, stuff it down. And she's literally doing a motion like pressing down towards her pelvic floor. And she's like, do you think it's a wonder that I ended up with prolapse? Of the falling downward, of pressing downward. So we all need to receive support and help on all those planes to truly and completely heal.
Yeah. So the body is manifesting often what's happening emotionally.
Which you just did a beautiful episode on. Your symptoms are signals.
Yeah, I think that was like 288 or something. Y'all check it out.
So good.
Oh gosh. Well, thank you so much for being here. So can you real quick, we didn't hit the technical terms, just blow through those real quick. Like what are the words we should be, mamas? Yeah.
Medically, you could be told you have pelvic floor dysfunction. You could be told you have pelvic organ prolapse or prolapse. You could be told you have a cystocele, a rectocele, a uterine prolapse, a vaginal prolapse. You could be told you have SI joint dysfunction, or hip bursitis, or hip flexor problems, or a DR, that separation of the abs. You could be told you have core dysfunction. Any of those things are really the same thing in the end. And if there's still time, I'd love to give everybody a couple of tips they can start enacting today. So simple things. You're going to be like, wait, am I doing this? Stop pushing your pee out. Y'all,
don't pee in a hurry. No peeing in a hurry.
No. It's meant to be a relaxation sort of affair. So you're not going to win by shaving off a few seconds if your toddler's banging at the door or your client is waiting. It's actually going to cause more pee to be left in the bladder if you try to push it out, which is going to mean you're going to have to pee again sooner thereafter.
So relax when you pee and poop.
Relax when you pee. If you are not already, get thyself a toileting stool, a squatty potty or otherwise. It actually helps with complete and peaceful emptying of both poop and pee. It's a wonderful gift if you haven't given yourself that yet.
And I think hemorrhoids in part can happen because the poop doesn't all get out and it just sits there and you have constant pressure. Whereas if you have a stool, I just learned about this because I was talking with I'm like, I don't want hemorrhoids. Let's talk about it with my midwife. And anyway, she's like, whereas the stool, just how it changes your anatomy when you're pooping is that all of it can clear out. And then you do need to be eating high fiber if you want to be.
Girl, you were so on the same page. This is another one of the indispensable things we have to do for ourselves is fiber and hydration. And you can't do just one. We need both. We need optimal hydration and we need optimal fiber. We always recommend 25 grams of soluble fiber a day if possible, which is a lot.
You can supplement if you need to, if your diet's not there yet.
Brown chia seeds are wonderful. Fruit, of course, is great. Another thing you can do is see a Webster certified chiropractor or an otherwise skilled manual therapist like craniosacral therapy. The reason we love Webster certified chiros is
Webster, you said? Like Webster's dictionary? Webster certified chiro.
So they're the only chiropractors who are trained to treat and adjust that pubic joint where the pelvis comes together in the front. And it is gentle, it's external, it's not scary. But a lot of groin and inner thigh pain during and after pregnancy comes from that joint being out, and then it causes your pelvic floor stuff to get worse because it spasms. So get your pelvis checked and aligned. That is a great and very meaningful gift we recommend for everyone to give themselves. And another thing is, I want to make sure I'm mentioning everything. If you are breastfeeding or pregnant, give yourself the grace to hold back on re-entering any high impact exercise. your connective tissue, your ligaments are not ready to receive that much impact yet, and it puts you at much greater risk for injury.
Oh, so, like pelvic floor issues.
Yes. Yeah. Or back pain or hip problems. So
okay.
Choose lower impact exercise if you are pregnant or breastfeeding. I'm not saying you can't, but just know that if you choose higher impact activities at that time, you are at greater risk for joints coming out of alignment.
Is there a window of time that they should be thinking of, or is it really like if you're breastfeeding, it doesn't matter if it's been a year?
Correct. If you are currently breastfeeding, because there is still some of that hormone change happening in your bloodstream all the time while you're breastfeeding that leaves your ligaments a little more like loosey-goosey.
Okay.
During that duration. And it's like one of those things, like nobody's talking to women about this. You're a grown up, you choose what exercise feels right for you, but know what you're doing if you make that choice.
Be conscious of your pelvic floor. That's all we're saying.
Yes, yeah. Absolutely. Absolutely.
Okay.
And then make sure you can start with our decompression technique, which I'll give you a link for. It is something that we teach in the program that we make sure everyone has access to, because it not only puts your pelvis, pelvic floor, hips, and back in a position to be able to receive a gift from gravity instead of more compression from walking around all day. Yeah. Simple, do it in your own home, and it takes you out of a fight or flight state too. Yeah. Sets your body up for healing at a nervous system level.
I love it. Okay, so real quick, tell them about what you have for them and mention the code so that they can get the discount. But I want you to brag about your program for just a second and let them know how it can help them, and if this is something they're feeling called to, or to keep it in the back of their mind for future, just in case. Yeah.
Absolutely.
Or tell your mommy or your sister or all the people.
Absolutely. Absolutely. And that's how the program was born. The women in our research study kept coming back to us and saying, can you please make a video of this? I know so many women who need this relief. And we listened to that and said, we don't need to wait for like the machines of Western medicine to catch up with offering this protocol. We're going to do it ourselves.
Yeah. By the way, I'll put the video of how it works in the show notes. It's probably on your website too, I'm guessing. So.
No, I love having it right there, because I know for you that was, and for many women, it's important to be able to visualize like exactly would I be doing here? Right. And it walks you through the same protocol we taught in our research and that we found worked for us. And then for the women in our clinic, which involves some self-assessments first, like, okay, where am I starting from? And we walk you through all of that. Some mindset work for setting expectations for the journey ahead. This is a holistic process, and it has to be. The next thing you learn is a set of tools that bring you relief right now from whatever it is that you're dealing with. We call them our recovery tools. It's like strapping on a tool belt of like, okay, I know what to do to take care of me now. I'm going to feel better. Then you start learning the movement series, the exercises, which once you've got it down, takes 10 minutes a day.
That's it.
Yes. And we value that immensely as busy working moms ourselves. And we spent a lot of time dialing it down into just exactly what you need to do to get the relief that we know is possible without anything more.
But it's like, think about it, because 10 minutes a day, but how many minutes a day are you pooping? How many minutes a day are you peeing? It's an investment in those minutes too. So you're giving 10 minutes of this extra work in order to enhance the quality, decrease the pain of peeing, pooping, and penetration and orgasm. Yeah. I mean, right? So there's so many things here.
And we're stopping that piece of feeling broken at our center and letting our life be ruled by concern about where the next bathroom is. Or am I going to make it in time?
Yeah. Or like, how thick do my underwear need to be? That's been me this pregnancy. I'm like,
bringing a change of underwear with you when you leave the house. I mean,
I've done it. You better believe it. I've done it.
So that life does not have to be your life.
Right.
And the Signature program is a path to find that relief. It works.
Yeah.
And if you have any concern about whether it's right for you, that's where that quiz comes in. And last but not least, we also have an offering that we've just coming out with called Healing from Home. We noticed that there was a gap. We were not able to offer women the kind of holistic guidance about early postpartum recovery that we wanted to be able to share. And so we have a new offering that's coming out soon called Healing from Home that fills that gap of holistic care for mom in those early weeks postpartum.
Ooh,
where you can even begin.
I want that.
The Signature program. So it's almost available, and Lizzie50 is the code that will get you $50 off of either one of those the Signature program.
That's LIZZIE 50.
And you can bundle the two together if you're like, man, actually I need both of those.
Oh my gosh, $50? You're taking off $50 for my people?
Absolutely.
I'm just like, thank you, guys. That's a lot. $50. You could have Starbucks for a month on $50. You could go to a nice meal with your husband for $50. That's so nice of you. I love that. Thank you.
I love it.
Lizzie 10. No, Lizzie 50. Sorry. Lizzie 50, not 10.
Lizzie 50. And it's the game changer. You get lifetime access. There's an app. All the fun, the accessibility pieces are built in, and you get membership in our private community.
You guys are so legit. Like, don't be deceived. Just because she's been so nice and flattering, her program, you guys, they are like the next big thing in the pelvic floor. Like, you guys need to do this program. So just because she's nice and relatable, don't think that, it's just some random program. Like, this is so genius. Women can do it from their homes. People, no wands up your vagina, people. It's so good.
Wow. It is amazing. And it truly feels like a miracle, because when you give the body the right nudge, it doesn't take much.
Right.
It's miraculous how easy it feels. And it feels good as you're doing it. Mm-hmm. It's just an incredibly therapeutic routine that is life-giving on every plane of your being. And it is a massive part of healing from your center outward. It's an amazingly empowering process.
Love it. Thank you so much, Christina. And send Jenn, not Sarah, send Jenn our love as well. You guys go to their website, tightenyourtinkler.com.
Look, we're on Instagram, and we've got tons of education on YouTube, because we know how it feels when you're like, okay, I've got this, but I really want to learn more about this, or I've got a question about that.
Yeah.
All that stuff, we do all kind of deep dives, and we share all the personal nuggets, and all the stuff you're scared to Google is on our YouTube channel, and we've answered all of it and done all the deep dives.
Okay.
So Instagram, YouTube, website, we're all places.
I love it. Thank you for doing that. I feel so much relief already. Like, just like, I can educate myself even before I buy the program, so I even know what I need. That's so great. Okay, so we'll get her YouTube, their Instagram, and their website in the show notes, okay? So just go to the show notes. You'll have everything you need. Christina, thank you so much again for all of your kind words, for your time, and we will wrap this up. We love you guys all so much. Okay, bye.
Hey, Lizzie here.
You might be wondering, okay, so Lizzie's pregnant. She's having a baby soon. But how do I work with her? How do I get support? Let me answer that question for you. The best way to work with me right now is to purchase my online course. And then if you've gone through that and you want more support, you can hire me as your coach. I am available. I am just being careful on how many clients I'm loading, down the pipeline. But you can actually have me via my course. And then I am offering remote coaching and private coaching. To get my course, you just go to LizzieLangston.com/course. And I feel like my course is the next big thing. Okay. It's so good. And then you'll get my 3 main steps. You'll get worksheets. There's all the videos. And then you have access to me in the comments. And I always reach out and introduce myself to people who buy my course anyway, because you're so special to me. And then from there, like I said, we can set up more support if you're wanting it. So again, LizzieLangston.com/course. The course is called Postpartum Freedom. It is really good with postpartum anxiety. It is good with soul searching, finding yourself in motherhood again, regulating your nervous system, trauma, all the things. So go grab it, and I will see you here next week. Thanks for listening and sharing and reviewing, and love you. Bye.